It is that time of year. Allergies, colds, flu, plus, of course, COVID is still hanging around. Some of the symptoms are the same. So how do you tell the difference? And what should you do if you're not feeling well? Joining us for To Your Well-Being is Cone Health's Dr. Laura Murray. To start, let's just go ahead and say, how similar are the symptoms of the seasonal allergies, the cold, the flu, and COVID-19?
Unfortunately, Tanya, they're very similar. So lots of crossover. These are largely respiratory symptoms, and a lot of them are caused by respiratory viruses. So they affect the nose and the throat and the upper airway passages, and so a lot of the symptoms are very, very similar.
Okay, so that in there is the issue, right? A lot of the symptoms are very similar, but there are some symptoms that may be unique to each one to help identify what we're experiencing. So what would those be?
So when we think about allergies, let's start with maybe the easiest one and the least deadly one is allergies. So allergies are essentially reactions to particles that we breathe in, and so typically we have symptoms really in the nose and the eyes. And so whenever you get into itchy, especially with the nose and the eyes, that's often allergy. And so that's something to keep in mind. Runny nose, sneezing, itchy eyes, watery eyes, especially if that's all there is. High likelihood that it could be allergies, although it could also be just the beginning stages of a cold or COVID or flu.
All right, so then what then gets us into symptom-wise into flu and then COVID?
So I think when we think about the flu and we think about COVID, these both have a lot more of what we call systemic signs. So a lot more with the whole body getting involved and less with just the nose or just with some sniffling or coughing or watery eyes. So we tend to have more in the way of fever or feeling feverish or feeling achy. We tend to have more with draggy. I don't want to get off the couch. I feel terrible. I might be achy. I might have actually sore muscles, or whatever it is that usually hurts is actually also hurting more now. And then sometimes, I wouldn't say that the GI symptoms are the predominant feature necessarily of COVID or flu, but you can certainly see vomiting or diarrhea with the flu or with COVID, and typically not so much with a cold.
Right, and are there just a few certain symptoms that we should look for COVID-wise? I mean, back in the day, we were hearing it was the loss of taste and smell. Is that still one of the most common?
Still maybe more likely to occur in COVID. There's a high likelihood of not having taste and smell when you have COVID. There are a few other things. Bad sinus can also give you some loss of smell, so I wouldn't hang my hat on that, but I do think there's a lot more with loss of taste and smell with COVID than there are with other illnesses, so higher likelihood if you have lost taste and smell.
Okay, so we kind of went over the symptoms that might help us figure out what we're dealing with. Is there anything about how any of those start that could help us signal what it is, how a cold starts or how COVID starts or how flu starts?
That's a great question. So typically we in classic flu, we think of flu starting suddenly, sudden onset of I felt fine a minute ago and now I can't get off the couch and I feel hot and I'm coughing and I just feel miserable, and it happened really fast. So that's like a classic definition of flu. Everybody who has flu doesn't feel that way, but a number of people will have sudden onset of symptoms. So that can be a clue. I think with a cold, you tend to have symptoms creep up over a day or two, and with allergies, certainly you can see symptoms creep up over a day or two. And with COVID, honestly, it seems to take a little bit longer. So people are exposed, especially last year with the first waves of COVID, we saw people taking a little bit longer to get sick and feel sick after they were exposed to COVID. And be sure that there really was something going on. So a little bit of a difference there perhaps between flu and COVID.
Okay. So what do you do if you start to feel like you're having some kind of symptom, whether it's, flu or if you think it's COVID or if you think it's allergies? Do you call your doctor at the first sign? Do you go run and get a COVID test at first sign? What is your recommendation?
That's a great question. We get that one a lot. So, the first thing to keep in mind is that if you are coughing or sneezing or blowing your nose a lot, you are potentially putting infectious particles into the air and you could make others sick. And so that's the first thing just to be aware of, is that coughing, sneezing, blowing your nose a lot These are all things that suggest a respiratory virus and should be treated with caution. And so at this point, I would say mask, social distance, keep away from people. If you're coughing uncontrollably or blowing your nose a lot, really shouldn't be out in public sharing that with people, regardless of what's causing it. And then I would say if you have fever or achiness or other more severe symptoms that aren't just sort of sniffles or cough or runny nose, then I would think about getting a COVID test. And I think a lot of places you'll see this year are going to be testing not just for COVID, but also for flu, because as we get into flu season, it may be hard to differentiate.
Sure. And is there a time when we should go to the emergency room? Like, just don't even pass go, just go to the emergency room.
Anytime you are having trouble doing usual activities with your usual level of assistance. So for example, if you're usually able to be up and around without any assistance at all just fine, and suddenly you really can't get off the couch without help, that's a marked change. That should not be ignored. And so it suggests that something could be going on. If you're somebody who usually needs a little bit of help to get out of the chair and go to the bathroom, and suddenly you need two people to help you get up and out of the chair and head for the bathroom, that's a big change in status in what you're able to do compared to what you can usually do.
So let's kind of go back to last year. How much did wearing masks and not gathering as much help prevent respiratory illnesses and flu?
Oh, it made a tremendous difference. I mean, I think it really underscored for us the importance of wearing masks and social distancing and washing our hands a lot, and just how impactful that is on the transmission of respiratory viruses. Absolutely.
I mean, I don't think any of us want to go back to not going anywhere and not doing anything and not seeing anyone, right? But let's kind of look at what's happening this year. Are we seeing a rise in cases this year, flu-wise?
No, actually, nationally, we're in kind of a low zone as far as flu, so really not seeing a whole lot of flu activity. A couple of cases reported here and there. North Carolina is in a minimal transmission zone for influenza right now, or influenza-like illness. And I think that also it is a helpful and hopeful factor. We all remember not having much flu last year, and we'd like for that to be the case this year. And I think a lot of it will have to do with our being aware of respiratory symptoms and just trying to not to share them with others.
Yes. Okay. So, of course, no one wants to be sick, not with COVID, not with flu, not with cold, not with anything. So what steps do we need to do to protect ourselves from the regular everyday stuff to the COVID that we're hearing about in the news all the time?
I think one of the things that's really key is if you see somebody coughing, sneezing, blowing their nose a lot, maybe keep a little distance. I think that's a huge factor. So keeping a little distance, if you have a mask and want to slip one on, I think that's a good time to do it. And then when you are the one who is coughing, sneezing, blowing your nose a lot, being aware of keeping away from people, right? These are things that are contagious, and we know something about how to prevent that now, and so being aware of that. I think there's some other things we can do as far as keeping ourselves healthy, eating well, getting enough sleep, getting some exercise, not letting stress run our lives. These are all things that play a role. When we're well rested and healthy, our immune systems just work better. And so giving our immune system that opportunity to go to bat for us is really important as well.
I mean, you hear that all the time, get a good night's rest, exercise, eat right, right? And we all kind of be like, yeah. But sometimes it actually is difficult to do.
It is. And I think just trying to keep that in mind when you're thinking about, I want to go do this and I want to go do that, and just being aware there could be an infectious cost. You know, if we're staying up too late all the time, or if we're always just eating whatever in the car on the way to where we're going, those are things that take a toll, and you're really weighing, is that a toll I'm really willing to pay?
All right, so if you do get sick and it's cold or flu, what steps can we take at home that will help us feel better? You hear all kinds of remedies, but what do you suggest?
You know, honestly, most things will run their course. And so just, when the flu does take you down or a cold does take you down, we expect a cold to run its course in a couple of days, and getting enough rest and trying to keep away from people while you're the most contagious, i.e. when you're doing the most coughing and sniffling and blowing your nose, are important features. getting a little extra rest, pushing fluids. We tend to get a little dehydrated if we're blowing our nose a lot or coughing a lot or having fevers. And so I think that just pushing fluids and getting rest at that point go a long way.
Yeah, I think we forget to like drink water, right? Because
I think so.
we're just miserable at that moment. All right. Thank you so much for your time and your expertise and telling us a little bit of the differences between all of those and the symptoms and what you should do. If you missed any of this, what we're going to do is we're going to put it all on our website for you so that you'll have it to go back, watch with your friends and family so you guys can talk about it as well. It will be at WFMYnews2.com.